priorities, all the priorities, and devoted a lot of time for education and prepare for a strong comeback, hopefully. Just a little bit about myself. I'm Dr-calin. I'm a restorative dentist from Romania, and I've been practicing in Romania since 2003 until 2017, running my own clinic. And it was an amazing journey, and I was lucky to team up with very talented dentists, including my sister, the one in red here. She's an amazing endodontist. But in 2017, I decided to relocate myself in Abu Dhabi and join Dr. Ana Salum, who is an amazing prosthodontist. And since then, we have been collaborating in some very interesting projects, hosting over-the-shoulder live courses about anterior and posterior rehabilitation with ceramics. And we really put up some comprehensive courses covering all the stages from prep to delivery and everything in between, like dental photography, smile design, and also showing all stages in the lab. And everything picked up really good, but now, of course, we had to postpone the agenda due to the current situation that we are in. But hopefully we will be back on track really soon. Now, whoever landed on my Facebook or Instagram account, they have noticed that I'm an avid promoter of the rubber dam isolation, and I emphasize on its importance for the quality and the precision of the restorative dentistry and the delivery protocols. And I see that many dentists do not use rubber dam on a regular basis in a daily routine practice. And I can say I understand why, because rubber dam is a technique-sensitive procedure that can be so frustrating if one of the many tips and tricks is not known by the dentist. And I remember in the beginning, I hated rubber dam. I've tried many times and I abandoned it. And I have to confess that I created the rubber dam master course that I have available online, thinking how much I would have appreciated back then to have access to such a course where somebody can explain all the shortcuts or all the recipes and all the tips and tricks just to save me from all the struggle that I believe that everyone starting with rubber dam experience. For example, as one of the first discouraging factors, it is enough just to use a low quality rubber sheet that keeps on tearing, and usually this is the first moment when any dentist can be pushed to give it up quickly. That's why I consider first thing, the quality of the rubber sheet is crucial. And the most important thing is that the rubber sheets, they should be non-latex rubber sheets. Non-latex rubber sheets, they have amazing elasticity and resistance to tear, and also nice texture. They are very pleasant to work. Okay, the latex one, they have a really annoying texture, and even the sound is quite frustrating. So the rubber sheet, but there are also a lot of other discouraging factors. For example, not knowing which clamps to use and eventually traumatizing the soft tissue. Not obtaining a good stability of the clamp on the tooth, and the clamps can detach and fly in the room. Or not obtaining a proper inversion, and eventually the working area will get flooded with saliva in the middle of the procedure. This is extremely frustrating. You start it and you're in the middle of the process, everything is fine, and suddenly you see saliva coming in the area. Or improperly positioning the rubber sheet frame on the face of the patient, let's say blocking the nasal airways, or having the lower margin of the frame pressing the chin of the patient for a long time. This is quite painful. Rubber dam can also be time consuming if not mastering the proper workflow. And I can go on and on. I can go on and on. There are a lot of factors, discouraging factors. And I know it is hard for an experienced dentist who has used to work with rubber dam to switch, one who didn't use rubber dam to switch with working with rubber dam. Actually, it's much easier for a student because they learn the proper way from the beginning. But now, since I talk with a lot of dentists because of the online course, and I really devote some time to communicate with a lot of dentists, I notice that after few successful episodes are accomplished, this is triggering a nice and healthy addiction to what I think should be the stage for proper restorative dentistry. But why do I think rubber dam is important? And now, especially in these times, amongst many reasons that I will mention in my presentation, and I've posted a video a few days ago on the group mentioning the advantages of the rubber dam, and I might repeat myself here, but this is just for the dentists who didn't see the video. But amongst many reasons, one seems to be more important to mention in the context of what's happening now worldwide. And the question is the rubber dam reducing the risk of infections? Because I've been looking in some studies related to the subject, and some are mentioning this as a conclusion, and I quote, "Minimal airborne contamination if a rubber dam is used." So this is even in the guidelines of for the infection control in dental health care settings that was published recently by the CDC. And amongst, of course, other recommendations, it is mentioned that the use of rubber dams and high volume evacuators, HAV, are considered to be appropriate work practices, precautions that always should be followed during dental procedures. Now, I am coming to support this with everything I can in my presentation and show, from my perspective, how we can push the rubber dam to the maximum in the direction of helping in what I said above. What we know is that indeed, during many dental procedures, the use of the rubber dam will eliminate all the contamination arising from saliva or blood. Once the rubber dam is properly placed, saliva and blood are not involved in the operatory field. Okay? I'm going back. Saliva, and eventually you will have bleeding if you have a class 2 cavity in this case, and then rubber dam completely getting out of the equation the saliva and eventual bleeding. So here I'm quoting again from the article, and it is obvious the only remaining source for airborne contamination is from the tooth that it is undergoing the treatment. So this will be limited to airborne tooth material and any organisms contained within the tooth itself. So again, with the rubber dam, we eliminate saliva and the blood from the equation, and we only have the tooth. I particularly have chosen this photo to show the one tooth. But of course, this is not enough. It's not enough just to put the rubber dam, okay? We need to evacuate as much airborne contamination as possible before it escapes the immediate treatment site. Of course, it's good to have HEPA filters and another, I don't know, like to wear the latest and the best masks and shields. But why not to remove as much airborne contamination as possible before it escapes the immediate treatment site? And I quote again, "The use of a high volume evacuator has been shown to reduce the contamination arising from the operative site by more than 90%. Okay, but for the practical point of view, I hope nobody needs studies and articles to agree that the suction is more efficient if it is applied in in a controlled, contained area, focused only on few teeth that are exposed to receive the treatment. Here I'm working on 3 teeth, not 24, or not, hopefully the patients have 24 teeth nowadays. But anyway, the area is controlled. I mean, imagine, this is common sense. If you have a guy who will come in your house to paint a wall, he will immediately, the first thing he will do, he will put some plastic protection on your furniture, on the other walls, and this is common sense. You don't need studies to agree with this theory. But other than the advantage of reducing the risk of infection that I will mention again and again in the presentation, because I think this is very important nowadays, just for the sake of the adhesive dentistry, we must avoid the contamination with blood or saliva of the areas where we want to proceed with the bonding or with composites, doesn't matter. Because most of the time the margins of the preparations are placed subgingivally, so if you don't see these margins and evaluate the fitting of the restoration, or let's say to properly layer and adapt composites, if you want to see these margins, you have 2 choices. It's either use rubber dam, or, like in this case, or to use retraction cords. From my experience, of course I use retraction cords, I take impressions, but I notice and I feel that they can be more traumatic than the rubber dam and clamps, of course if you place the clamps properly. And also, at least for me, the cords can actually be more time consuming. I literally spend more time in placing the cord and dealing with the bleeding than the rubber dam. And as I mentioned, the cords can cause more bleeding, which sometimes is hard to control. That's why I prefer to isolate with rubber dam. And in this situation, we are sure that bonding and adhesive material agent will properly condition the surface and no contamination with saliva and blood will take place. I will say this again and again. I'm repeating myself, but that's the whole idea. And please notice how nice is the feeling when you do this and you are not afraid that anytime soon saliva or some bleeding might invade your space. There is no stress. You control the situation. It's not a situation which is controlling you. So once you see the margins, you have an immediate feedback. You can control in real time and evaluate the proper fitting of the veneers and crowns before and during the delivery. Also, you can easily clean the excess of the bonding material. The excess of the cement will be on the rubber sheet, not on the gum. So again, I will address the question of if it's time consuming or not. You have to put in mind that you also save time. For example, when you remove the rubber dam, everything will be clean and you will spend less time removing the excess of the cement, because the excess is on the rubber sheet, as you notice in this photo. But one of the biggest advantages of the rubber dam is that it is raising the satisfaction about the procedures while you are working. I mean, look at this case. Don't you feel better to see in front of you a wide and comfortable working area, having the cheeks and tongue and lips and gingiva retracted and also protected in the same time? I'm going back to this photo. This is the same case actually. And now the blue magic happens. Everything is retracted. Actually, you can manipulate the rubber sheet in such a way that you can make space around the teeth, so you will have the freedom to prep and to clean the excess of the cement and even polish and maximize the time that you actually use the rubber dam on. You have more light and visual comfort, So again, the satisfaction about your work is definitely higher. And I don't have to mention, but for endodontists, of course, rubber dam is absolutely a must, because we are dealing with irritants such as sodium hypochlorite, and that can damage the soft tissues in the mouth, and even it can be harmful if swallowed. And also, rubber dam eliminates the chance of swallowing or inhaling small restorations. Please don't do this. I pushed the limits here, and I basically created the smallest inlay I could have done. That was just to push the limits, to push my limits and the technician's limits. But anyway, if the patient swallows this, it's quite a dramatic scenario. So rubber dam again. Is the rubber dam time consuming? Because I got asked a lot about this issue. And the answer is, it certainly is, until you master the workflow. But however, rubber dam significantly saves time by reducing the ability of the patient to communicate. This is my son here, and he's over talkative. And of course, in this situation, the rubber dam will facilitate a faster treatment. But also, do the math. How much time do you save if the patient doesn't get up to rinse every 2 minutes? And remember, you have sometimes patients that are rinsing for 30 seconds every time until they finish the water from the cup. So again, you will save time having the rubber dam on. Many dentists are using the rubber dam, but what they are doing, first they are removing the fillings. They clean the cavities without the rubber dam, and eventually and hopefully only after this they will continue with placing the rubber dam and, let's say, delivering the restorations or directly restoring. What I want to highlight here is that actually I consider is more convenient to place the rubber dam before doing anything. Because, and here I'm mentioning again the importance of this approach in the context of reducing the risk of infections. Because let's say we live in a germ-free world and you don't care about any microbian or virus contamination, okay? Just for the sake of the procedures, just from the procedures perspective, please tell me, isn't it better to have the cheeks and the tongue retracted and hidden under the rubber sheet to allow you a good visualization of the working field, to have the gums retracted, to have more light, also to protect the patient from inhaling the grinded and small parts when you remove fillings or caries. I mean, look at this case. Like a big patient with big tongue, saliva. I really admire a dentist who can work properly in this case, because honestly I can't. Okay? So just going back to the case. One of the biggest advantages of prepping with rubber dam is actually that you have the chance to properly do the immediate dentin sealing. Relaxed, without the permanent fear that some bleeding might interfere at any time. Of course, to refine the occlusal preparations and to provide enough clearance for the ceramics, because you have the rubber dam on, you don't see the lowers. You need to remove the rubber dam and evaluate that in relation with the lower teeth. However, for scanners users, I am soon producing and publishing a bonus in the rubber dam master course, a module that actually I will add for free, because I'm doing this. Once a dentist purchases the course, he will benefit of new updated materials that will be added in the course for free. But anyway, for scanners users, I will produce a module where I'm explaining how to prep with the rubber dam on, scan with the rubber dam on, put the temps with the rubber dam on, and how I manage to have, and what do I do in order to have perfect onlays in terms of occlusion. I hope this will be added really soon, and I will try to update everybody on the group. But going back to the case, the same goes in the delivery session. Same rubber dam setup, and everything is bonded under the same isolation formula. This is the preparation session, this is the delivery session. I'm going back. Preparation, delivery. Basically, the rubber dam is placed in the same setup, same recipe. And of course, we will properly deliver all the ceramic restorations and restore the full quadrant. If you noticed, I also did the composite on the last molar. Okay, look at this case. I'm repeating myself. Rubber dam before. I don't touch anything. I place the rubber dam, the gum is retracted, and I even use the Profijet after I place the rubber dam. Why should I use it before? Of course, you need to clean the teeth before the composites. But if I use the Profijet before, I will have a lot of bleeding, especially in cases like this with improper hygiene. But in this case, at least I don't face any bleeding of the gums while doing this. And I can go ahead and prep deep margins. And the fact that you placed the rubber dam before actually helped me stabilize it in the sulcus with the floss. And as long as you don't touch these margins with if you don't touch the rubber dam with the burrs, the rubber sheet will stay there, and even if you extend the prep really close to the inversion area. Or let's say you can touch the rubber dam, but you really have to use low RPM and and the burrs they need to be maybe red or yellow. So don't go with high granulation next to the rubber. But again, there is no bleeding, no saliva, everything is clean, and you can already proceed to restore and continue with this setup as much as possible, and even do the polishing. And you can finish the case, because as long as you are not you don't have restorations on the palatal side, you can do everything with the rubber dam on. Of course, if it's on the palatal side, you need to do occlusal adjustments, but at least you have limited the time working without rubber dam. You have limited this time to the minimum. Let's evaluate another case and show you why I consider that it is more practical to place the rubber dam before and not after, or even not during the procedure. And many dentists would have this approach. Let's say, okay, they know they have to prep for crowns, and then they start prepping, like exploring, saying, let's see what I will get from the tooth after I prep. And then I will decide, do I need to redo some fillings? Do I have caries? Never mind. I will start prepping and I will see. But you know from your experience that most of the time you need to replace old restorations, or even restore with posts and build-ups. And sometimes it is very obvious that, and you anticipate that you need to do this and restore. But I consider that it is really about being ethical or not, to either hurry up and just prep wherever you find and just take the impression, and don't lose time with small things like replacing the old composites, because you are oriented towards like production and having more income in the same time. Or you can use your experience to understand that as long as you see overhanging fillings with recurrent decays, there is a clear sign that whatever is attached to the tooth structure it is very unlikely that it is properly bonded and reliable as a support for the new crowns. And some dentists might say that it is not important because bonding to dentin is not good anyway. But in my perception, a properly bonded new fresh composite on the rubber dam is better than the old one that has micro leakage or caries, and they usually detach just from the vibration of the burr. So I really hope that everyone agrees with this. So my conclusion: rubber dam before, whenever I can. Of course, there are situations where when you can't, and you have to remove, let's say, bridges or a lot of other scenarios that I can mention. But I'm actually placing and I'm using open rubber dam, and I'm explaining in the online course why I think open rubber dam is much better in terms of retraction and protection for the patient than the normal retractors that we know. But just as a note, I'm switching to full isolation when I deliver the restorations, like crowns or veneers. I always do full isolation. Like this is the same case actually, and this is the delivery session. So going back to the case, if you place the rubber dam before, for the preparation and restoring purposes, you have a huge advantage. The convexity of the non-prepped teeth will help you insert and glide and stabilize the rubber sheet next to the sulcus. But if you prep before, there is no way you can place the rubber dam like this, properly inverted, unless you are using clamps. And in this scenario, using clamps will not let you do everything I did and I will show in the next slides. It's not so practical. So again, but I want to mention something actually. First thing that you have to do is to check if you have any overhangings and to anticipate the fact that you need to facilitate the gliding of the rubber sheet. That's why, if you notice between the two centrals, I stripped the overhanging fillings just to let the rubber dam glide towards the sulcus, and only then I started with isolation. If you have the rubber dam set up, so this is your stage now. Now you can start working. Now you can start exploring. You can start even doing some initial prep. Remove all the fillings, clean the caries, do the initial prep, and evaluate the remaining tooth structure. But now it's totally different. Now I can do everything I want. Everything is isolated. I can sandblast, I can place the posts and the build-ups. And okay, just a short note here. I know that all the endos have been properly redone before. So I can clean all the caries and do the posts. And rubber dam is still inverted and stabilized in the sulcus with the help of the floss ligatures. And I can even do some initial preparation with the rubber dam on. If you notice in this footage, I am prepping for crowns. Of course, I will remove the rubber dam and I will refine the preps, but what I'm doing, I'm maximizing the time that I have the rubber dam on and I'm protected. And please confirm if you think, and I'm expecting anyone to comment on the group, if you think that the suction is more efficient in this case. It is not blocked by the lip, by cotton rolls, overloaded with saliva, and I really don't think anybody needs studies to agree with this issue. So again, I reduce the time only to refine the margins and to take the impressions. In the delivery session, I use the same setup, but now you can agree that actually I need clamps, and not only clamps, I need strong clamps to do the isolation. I cannot do it like before. I need strong clamps to place, to hold the rubber sheet in place and obtain a proper inversion. But the placement, the setup is the same. I use two clamps number 2 on the first plimorus without punching, holding the rubber dam sheet, and I'm explaining actually every detail how to use the anterior isolation in the course. Delivery, proper delivery, I see all the margins, I sandblast, I'm respecting all the details from the adhesion protocol, and see how nicely are the margins exposed. Look at this margin, how nicely it's exposed. So you can finish the delivery. So going back to the initial situation, why not to anticipate the problems and properly restore the support for the new crowns? Because after all these concepts of smile design, digital workflows, 3D scanning, CAD/CAM technology, 3D printing, the most talented technicians that you can have that will craft for you amazing ceramics. And I have to say that, and I confess, I'm very thankful to have access to all of this, and maybe that's why I love being a dentist nowadays. But what I'm trying to say that even having all this in your life, and it will come the real moment when you are holding in your hand a piece of porcelain that you will have to bond on something. Now, what is that something and how do you bond it? This is totally up to you. And this moment is not a fancy moment. It's just a real moment. It is not digital. It's just real and responsible. Let's see another case with anteriors. Again, rubber dam on. 1, 2, 3. Rubber dam is on. Same protocol. Rubber dam is placed, exposing canine to canine, and I have the anchor 2 clamps placed on the premolar. And I got a question, why do I place these clamps? Because I need some retraction towards the distal, so I can have the freedom to work from the palatal aspect of the teeth. But again, if you noticed, I anticipate the moment of the gliding of the rubber sheet through the contacts, and I partially remove the overhangings, and even I lubricate the proximal surfaces. Long time ago I used Vaseline, but if you use Vaseline you really need to clean the area, and I think it's better to use actually glycerin because it's water soluble. Anyway, so lubricate everything, again remove the overhangings, but I don't touch anything else. I even do some cleaning with a Profijet, like I mentioned in the previous case, and while doing this I have no bleeding. Then you can start to explore. You can start removing all fillings, you can start even do some initial prep like you notice, sandblast, you can go ahead and place posts and doing the build-ups. But again, notice that the rubber dam is stabilized in the sulcus. Why? Because I placed it before touching anything, and the convexity of the teeth helped me to glide the rubber dam and to stabilize it in the sulcus. I can do icon infiltration, I can do composites work, although I was not so happy with tooth number 8. That's why we actually did the veneer on tooth number 8 along with the crown of tooth number 9. And just go into the delivery session, and please notice again, when I do the delivery I use the same isolation protocol. If I don't mention anything, you might be tempted to say that the photos are from the same session. Going back to the preparation, just a second. This is the preparation session. And if I go back to the delivery session, you notice that actually the setup is the same. So you can rely on the same recipe every time. Only that, as I've mentioned, now you really need the clamps to isolate. Now you cannot go with the rubber dam in the same position like before, because the margin is not only that it is already prepped, but it is deeper than before. So you can continue with bonding. In this case, we have used zirconia coping layered with ceramic to mask the dark substrate of the tooth number 9, and also an Empress veneer on number 8, along with the crown on number 9. Why we have done this? We wanted to obtain the same color of the abutment of number 9 as the prepped number 8. So in this way, it was possible to use the same blocks for both teeth, for the veneer and for the crown. Same translucency and same color, and even same thickness, because we can digitally control the thickness and anticipate the thickness. Anyway, so I'm delivering the zirconia coping. The coping is delivered, and this might look awkward for everyone, but I actually used hydrofluoric acid to etch the ceramic layer, because on the zirconia coping we have also layered ceramics to be able to etch it and obtain adhesion with the next layer, which is the crown. But knowing that I've provided the proper isolation, I know that I'm not facing any risk while doing this. The tooth, of course, is etched with phosphoric etch. Then I finish with the delivery of the veneer. Then I will go ahead and deliver the crown. And this is the final situation, before and after. Somebody can ask, okay, so you are showing only rubber dam in the anterior area. Of course, and actually it is more useful in the posteriors. And let's see another case with posteriors. What is the first thing that I'm doing here? Am I removing the fillings? No. First thing that I'm doing, I am placing the rubber dam. Of course, I check before with floss if the contacts are allowing the sheet to glide towards the sulcus. If I have overhangings, I'm reducing them with a diamond strip, or you will see that in the next case that I'm even partially removing some of the filling to open the contacts. But I'm not removing the entire filling. I'm just doing a minimal preparation just to allow the rubber dam to glide. So partial quadrant isolation from posteriors protocol. Actually, I'm explaining in the online course every detail and tips and tricks about isolating posteriors. The convexity of the teeth will help the rubber dam insert towards the sulcus, and it will help the floss ligature. And actually, the floss ligature is more effective in pushing and inverting the rubber dam. I mean, imagine you have to place the rubber dam now, after you remove the fillings. Not only that, here the gum will bleed. We all know it, no? Class 2 fillings, sometimes just removing the filling and even not touching the gum will bleed. And also it is harder, and you will struggle to pass the rubber sheet over the margins once the fillings are removed. And even in this case, like if the margins are deep. Sometimes the fact that you have an overhanging filling is actually helping you pushing the rubber dam towards the sulcus. Of course, you have to remove the overhanging that is in the way of the gliding of the rubber dam. But having the overhanging filling, basically the rubber dam will go like this, and here it will fall under the sulcus. So that's why I'm not removing the fillings. I'm removing the fillings after I have the rubber dam placed. I can start now cleaning the caries, and let's not forget about what I said before about the infection control. At least now I don't deal with saliva and blood. The only source of infection are the teeth, or even to be more specific, 3 teeth, not 20, 24, 32, and so on. So the suction is focused on an isolated area, and again, I don't think that anybody needs studies to agree with this. This is common sense. I think everyone can understand that this is very obvious. The suction is more efficient if I just put the tube next to the teeth and everything goes inside. So I try to do as much as possible with this setup. I'm doing usually every time I'm doing all the direct restorations on a quadrant in the first session, and I'm prepping for the ceramics with the rubber dam on. And as I told you recently, I'm scanning with the rubber dam on, but of course there are certain steps that you have to respect, and you have to anticipate the fact that you want to do ceramics, and you have to prepare for this. I will explain in one of the next bonuses that I will add in the online course. I will produce a really comprehensive and explanatory videos. But anyway, all the direct restorations are done in this session, and also the prep for the ceramic restorations, as I mentioned. So I finished the composites on the molar and on the premolar. And tooth number 30, I will scan it for an onlay. And again, this is the delivery session. I'm going back. This is the preparation session. If I don't tell you, you might think that the photos are from the same session, because I respect the same recipe every time, the same protocol. I know I can rely on this formula. And I am delivering the ceramic, respecting everything I can. Sometimes I even place this super floss under the contacts. Just it's more it's helpful when you actually remove the excess of the cement before it is curing. It's easier, and also it doesn't let the excess of the cement going under the contact point. Okay, and I'm doing everything I can with the rubber dam on, removing the excess of the cement, polishing. I just let the occlusal adjustment for the moment that I have to remove the rubber dam. And but anyway, everybody knows that nowadays with scanning, or even with good impressions and good technicians, you can obtain properly fitted restorations in terms of occlusion, and you don't have to devote a lot of time for this step. Okay, before and after, and you notice the rubber dam is in the same position. And I'm just showing this photo immediately after I remove the rubber dam. This is just to show you how proper placement of the clamps and floss will not cause any significant harm on the gums. Sometimes I even don't have any bleeding. But please tell me if it is the same when you put retraction cords. Retraction cords, I don't remember to have any moment when I don't have bleeding when I remove the cords. Let's go to a very simple case. And actually what I've tried to do in this presentation is, and actually I'm showing very old cases. Maybe these cases are from I think 3 or 4 years ago. And I'm not showing a lot of fancy cases with veneers and aesthetic cases, because I think now it's really not the time to brag and to show how good we are, and how now I think it's time to be responsible and to show how can we help each other and prevent infections and protect us and the patients, and really what we can do when we go back, and hopefully we go back soon, to really apply some procedures, some protocols that will decrease the chance of being infected. So again, simple case. Bread and butter of restorative dentistry, class 2 restorations, composites, even no ceramics. There are situations which you evaluate the case and the x-rays and you see and anticipate deep margins. And okay, now I'm not talking about the situations when the margins are so deep that you have to do crown lengthening. Again, that's a different topic, and this I will explore in one of the future modules in the course. But again, I keep on insisting on the importance of placing the rubber dam before. Of course, even in cases like this that I've mentioned, this is the bread and butter of simple daily restorative dentistry, class 2 composites. Would you explore and completely remove the fillings and the caries before or after placing the rubber dam? Or you will limit the time working exposed to saliva and blood and place the rubber dam before. Of course, you just partially remove the overhangings and break the contact. This is a minimal intervention prior to the insertion of the rubber sheet. Just enough to facilitate the gliding of the rubber dam towards the sulcus. And the fact, as I've mentioned, the fact that the filling is overhanging is actually helping you pushing the rubber dam over the margins. While if you try to push the rubber dam over the margin in this moment, I'm telling you, this is quite difficult. You really need to struggle and to manipulate the floss and eventually pushing the rubber sheet with a spatula and so on. But that's why I place it before. And only after this I will start removing the fillings and the caries. Everything is clean. I see what I'm doing. Imagine, here I will eventually have bleeding, a lot of bleeding. And now I can just go ahead and restore with new composites. Do everything I can with the rubber dam on, even the initial polish. And again, minimizing as much as possible the time that I'm forced to, of course, to take the rubber dam off and adjusting the occlusion and do the final polish. So I hope everyone was able to draw a conclusion how important it is to actually use the rubber dam before prepping, before doing anything, okay? And I'm mentioning again that the use of the rubber dam and high volume evacuators is a precaution that always should be followed during the dental procedures, because that means that the first line of defense against airborne contaminants is working at a full capacity, not being blocked by tongue, cheeks, or overloaded with saliva. And we should use it regardless of the fact that we are facing or not a worldwide pandemic. And because after all, it's really about us, okay? We spend 8 hours per day in one room, and it's up to us what we are breathing. Because we had and we will have other viruses even more harmful than corona. Anyway, so, and even from a business perspective, patients will appreciate, will trust a dentist who will reset all the protocols in terms of infection prevention. I mean, what's happening now should be a wake-up call for us to practice more responsible dentistry when we are back. Thanks for everybody who devoted their time to listen to this presentation, and I really appreciate, and I hope, and I will be happy to answer any questions. I will check the live after I finish the presentation, and I will try to answer any question. And even if for some reason I will miss answering some questions, please reach out to me on my social media, and let's keep in touch. And I hope that many dentists can benefit from the information that I've shared in this presentation, and will be motivated to work with RubberDam. And of course, you will definitely find more information in the main course available online. Let me just go back to the slide. And because, of course, I cannot show everything in just one live webinar, but in the course you will find everything structured and organized in super explanatory chapters that are not only showing RubberDam. I'm also presenting tons of daily work scenarios where RubberDam is in fact the stage, the decor for proper restorative dentistry. The course can be attended from any device in the same way you watch Netflix, for example. I mean, you watch it from your phone, you close it, you can watch it from the laptop, and you will see the same chapter from the moment that you have left the module. And the access is lifetime. Once it is purchased, the access is lifetime. And actually, it's an online platform where every dentist can comment and ask any question, and I will answer in the topic. Or if the subject requires more information, I will produce additional content that I will edit in the course as a bonus for free. And actually, recently I'm offering the course with 30% discount to support all the colleagues through this tough time. Thanks everybody, and see you online. Let me check some questions. Let me go back to the... Wow, now I see you're 315. Super, that's super. Okay. I'm trying to see. First of all, let me just post the link of the course for whoever is interested in the course. So this is the link. Suraj is asking, hi sir, in direct posterior composites, did you adjust high points under the RubberDam too? Of course, you cannot adjust occlusion because you don't know. You can anticipate. What I'm usually doing, I'm checking the occlusion before, and sometimes I leave the marks on the tooth just to anticipate the morphology of the occlusal surface. But of course, you cannot adjust occlusion. You have to remove the RubberDam and check the occlusion, of course. Okay, Dr. Shivraj. I'm amazed and its elasticity. Please tell us the brand. You told us it's not latex, yet I use hygienic latex dam is not even close in elasticity. I am using for many years ISODAM non-latex sheets, and I use medium or heavy. Recently I'm only using medium. Honestly, it is so flexible, it is so elastic that I don't notice a significant difference between medium and heavy. But as an advice, it's better to use medium because I don't know, I didn't test many rubber dam sheets, okay? Especially that I love this one and I'm only using this rubber dam sheet. But if the rubber dam is heavy, it might move the teeth. So you might have the surprise of having different contact points of the restorations that you had during the trying. And you might have even problem of inserting the ceramics. So, or let's say you do composites, okay? The rubber dam is already on. If you use heavy rubber dam, the teeth are moved. And you are happy that you obtain nice and tight contact points. And then you remove the rubber dam and the teeth go back to the initial position and you have open contacts. That's why I advise everyone it is better to go with medium rubber sheets. Just because I don't know other brands if the heavy is really heavy. Okay, because ISODAM is quite flexible and you don't have this issue. Let me see another message. Yes, exactly. So Niranjan is mentioning it has been shown in one of published articles and also in one of famous Facebook group that the contact point opens up after the rubber dam is removed in class 2 cases. So exactly what I said before. If you are using a heavy rubber sheet, but not only this, if you don't know how to manipulate the sheet in such a way that the tension of the teeth is not so much. If the teeth are tensioned, the teeth will move. So first of all, the rubber sheet should not be very rigid. Okay, avoid using heavy, at least for another brands than ISODAM. Use medium. And I don't know. You can go back to my previous post on the group. World Dental Association group, and I'm explaining in this video how I manipulate the rubber sheet in such a way that I will not obtain a lot of tension in the rubber sheet next to the teeth. How I go with the forceps in the middle of the mouth. I have enough reserve of material next to the buccal commissure, and I'm only placing the clamp on the tooth after I'm doing all of this. These small details are important in reducing the tension that the rubber dam reflects on the teeth. So I'm applying these principles since many years, and I really don't have any issues with the contacts. So I hope this answers this question. Okay, just a second. Okay, another question is, can we use rubber dam isolation in extraction or any dental surgery? You can place let's say you extract the first molar. If you really want to isolate the area, you can place the rubber dam on the second molar and cut it. Just use like a small window in the rubber dam, do the extraction, and at least this is helpful just to isolate the area, and you will not splash with blood all over the place. Honestly, I've never done it, but it's totally doable. I don't do a lot of extractions. My surgeons are doing this. Who click photographs for you? If it's you, how do you manage infection protocol with the camera between the steps? I am doing the photos, and every time I'm removing the gloves and I'm handling the camera, and I'm actually removing the glove on the other side, and I have a way that I place it back, or sometimes I use a different pair of gloves. Of course, I will not put my hands on the camera with the gloves that I'm using while working. Can you please tell us the type of the sheet you use? This is, I got asked by Apeksha. I'm sorry if I'm not pronouncing correctly. Once again, let me actually post it on the group, or I can just say it. It's Isodam. Isodam. I bring it from Germany. I don't know which is the representative on your area, but I can look it up and I can update everybody. Apshai Singh, to place the matrix band on the wing clamp. If you notice the case that I was presented, I'm actually placing the matrix, but sometimes when the margin is deeper, I have few 12A and 13A clamps that I use, and I've previously cut the mesial extension of the wings. I'm still using the wing clamps, 12A and 13A, depending on the side that you approach. But what I'm doing actually, I'm cutting the extensions to leave more room for the matrix and for the wedge. If I have time, I will post it on the group. Can you give tips on how to be effective in placement of rubber dam? I mean advanced rubber dam placement. This is what I'm doing in the course. The course is, I'm literally explaining every move and gesture, every single step that I'm doing, and I'm really devoted a lot of time and effort in filming with 3 cameras synchronized from every angle, and you will find as the most comprehensive material that you can find. I can honestly say this because I didn't find anything similar, and I say this with all the confidence. So please, Stefan, I have posted the link on the messages, or if you don't see it, please ask me on my social media. It's actually the link is posted on almost all my posts. You just scroll my Facebook and you will find the link for sure. How to remove the rubber dam? This is from Anchor. How to remove the rubber dam with floss ties in case of quadrant isolation, avoiding splatter of blood and saliva. Basically, I'm removing the floss before I remove the rubber. And I'm working with the assistant. While I handle the floss, she's there with the suction and she's helping me minimize the splatter and everything. Another question from Ajay Gupta. Show us methods to isolate in different conditions. I'm showing a lot. I'm actually approaching every scenario in my online course in the smallest details. Another question from Patru Loredana. How can we put the rubber dam if we have a dental carie on the distal and occlusal, or buccal and occlusal on the tooth 28 or 28? I think 28. Oh, second molar. I think the question is about second molar. I'm using different clamps, which has even if you use the 12A and 13A that I'm usually using in my in the posterior protocol, you have enough space towards the distal because the arch is not next to the tooth, so you still have space to prep. But how to layer the composite? It's a special matrix that I'm using, and this is actually a highly requested topic. And I was about to produce again another bonus that I will add in the course, and hopefully the lockdown is over soon and I can go back and finish this module. Can we give our clients rest if we are performing a long duration treatment? I mean, Of course, you cannot remove the rubber dam in the middle of the procedure. If you want to just let the patient close a little bit, okay, not completely, because he will bite the clamp. Of course, you can let the patient rest a little bit and partially close his mouth. But once everything is set up, you cannot remove the rubber dam unless you remove it and you devote the time to place it again, and so on. Let's say you have sealed the dentin, but this is quite tricky. I mean, all your efforts all the efforts that you have done, they don't count anymore. Please show us detailed tips when you have to do a subgingival margin. This is in the course, very well explained. Band placement wingless clamp is compulsory. Yes, of course, if you need to place the matrix, it's better to use a wingless clamp, but the wingless clamp will not hold the rubber sheet retracted. So what I'm doing, I'm modifying the clamps. I'm cutting the mesial extensions of the wing clamp, which is usually 12A and 13A. Any video demonstrating anterior rubber dam placement? I have 3 modules in the course with anterior rubber dam placement and bonuses. Tooth preparation with modification required. I don't understand the question here. If the question is if I'm prepping the teeth with the rubber dam on, yes, I'm prepping, as you have noticed in the presentation. Your preference, especially considering class 2 restorations, winged, may interfere. I already explained that I cut the extension of the clamp. Sagar is asking, can you show how to manipulate and place the rubber sheet, which clamps are better used? I have a special chapter in the course explaining only the rubber dam setup and all the tips and tricks about every clamp in particular, and all the modifications and the cuttings and the modifications that I'm doing. And also the placement, it is structured in modules. I approach anterior, posterior. I show all the scenarios possible. If it's possible to do crown preps with rubber dam in place, yes, as you noticed in the presentation, I did the initial preps. Of course, you have limitations. If you need to prep the second molar, sometimes you can, sometimes you can't. Sometimes you cannot prep. I recently had a case. I was not able to hold the handpiece. I didn't have space in the back for the handpiece, for the burr. Imagine I have to place the clamp and the rubber dam and to have space for the handpiece. And of course, if you prep for crown and if you prep the clamped tooth, you have the limitation of the clamp, because the handpiece will hit the clamp. And this is very common amongst the endodontists. They know that because the endodontists, they put the clamp on the tooth that requires treatment. And many of them, they are complaining, okay, but sometimes I hit the clamp with the handpiece. And actually, just like a small advice, if you can, for endodontists, if you can, put the clamp on the next tooth. So now you will have more space around this tooth, and you can even, after you finish the endo, you can do the build up, you can place a post, and you have more room to work. If it's possible, of course. You have a lot of situations that are very difficult for this scenario. Sir, if I don't have the scanner, so one have to remove the rubber dam and taking the impressions, you may still land up with contamination of prep site. What's your take on this? Of course, you have to remove the rubber dam if you don't have the scanner, and you have to do the impression. But you have limited the time that you are exposed with saliva and blood. It's not the same to work with saliva and blood for 1 hour or only for 5 minutes. And of course, you can, after you have done everything and you remove the, let's say, the class 2 old composites, if you remove the rubber dam, now you can control the situation. Everything is restored, okay? You just have to take the impression. Of course, you will have bleeding, but it's not the same. It's not for 1 hour. It's only for 5 minutes. Minimum number and size clamp must have in the armamentarium. You know what? I will post on the group and on the page if you want a short video with the clamps that I'm using. Anand, please let me know if I forget to do this. Bryant is asking for direct veneer composite. Medium dam for direct veneer composite. I have mentioned that actually I'm using medium rubber dam sheets. The wings of the clamps. Can we use them again, or the clamp? Cutting the wings of the clamps. I cut the wings of the clamps. I customized few, and I keep it for the same, for the next scenarios, for the same scenarios. Of course, the clamp is compromised in terms of using this clamp in the normal way, but you know that you have in your armamentarium few clamps that you can use only for these situations in which you have to actually place the matrix and restore class 2. I think that's all I have. But anyway, if I missed anybody, please reach out to me on my Facebook social media, or Instagram, or anywhere, or on the group, and let's keep in touch. And I really hope that everyone is motivated to use rubber dam. And again, I'm saying I have launched my online course before this dramatic events happening in our lives, just for the sake of improving the quality and the satisfaction of our work. So that's it. Hope everyone is safe, and let's keep in touch. Thank you very much.